Welcome to this presentation on trauma and trauma sensitivity. We want to start with a short introduction who we are. I'm here with my colleague Dyonne Sijstermans. She's a clinical psychologist and she will take over in a few moments. And my name is Wendy Notermans and I'm a healthcare psychologist. And we both work in a small mental health institution in the south of the Netherlands near Maastricht. And we both have a lot of experience in treating young people with trauma-related complaints. Health Tech Without Borders is, among other things, involved in supporting mental health. And because children are a very important group and do not easily ask for help themselves, we have been asked to tell you more about the impact of trauma and how we as adults can support these children. We will try to teach you more about what trauma is, what consequences trauma has on the brain, on emotion regulation, on social development and learning abilities. And we will consider the concept window of tolerance in detail, after which we will use this information to look at behavior through a kind of trauma glasses and how to respond to this behavior in daily life. And finally, we will consider the do's and don'ts in dealing with these traumatized children. I will start with explaining in a nutshell what trauma is. The word trauma refers especially to the consequences of a traumatic event, even more than the event itself. Experiences can be so drastic that it provokes an overwhelming sense of anxiety, helplessness, and fear, causing a child to become traumatized. This can be the result of a serious one-off incident or a long-lasting unsafe situation, such as neglect or abuse at the hands of a parent, or the war that is going on right now. Children and adults in war have experienced many traumatic events. For example, being bombed, sheltered in a bomb shelter, fleeing, saying goodbye to father, family, friends, and their familiar environment. Despite being traumatized witnessing the incident itself, children also can be traumatized by hearing of drastic events that happened. There are also broken illusions, like the world is not safe, or not all people are good people, and an awareness of one's own mortality that contributes to trauma. Traumatizing, especially in early childhood, has its impact on brain development, which thereafter has its impact on overall development, especially emotion regulation, learning ability, and social development. All of these developmental difficulties are reflected in behavior or behavioral problems. I will now going to tell you something about brain structures, a simplified explanation of brain functioning when it comes to trauma. And understanding of brain structures involved helps understanding behavior. When we talk about trauma, three important parts of the brain have to be understood. The first part is the brain stem, also called the reptilian brain. This part of the brain is especially focused on survival. It's a part that doesn't think, just acts. It regulates our autonomous functions like heart rate, blood pressure, and temperature. The second part is the limbic system. It's also called the mammalian brain. This part of the brain is especially focused on emotion regulation. In people which are traumatized, the system is sharply adjusted and it's really sensitive to every little sense of danger. So alarm bells are ringing really soon by any little cue of supposed danger, even if there is not danger in real life. And it's up to 10 times more often than people without trauma. The third part is the neocortex. It's also called our operating system, because it's the system that's capable of thinking and learning, and it helps us overthink and makes us capable of learning. I'm going to show you this brain structure by this house. This house symbolizes how our brain structures work and cooperate. Imagine a house where the ground floor is where all the emotions and needs are staying, what we call the limbic system. And the upper floor is the place for the thinkers, problem solvers, peacekeepers, the neocortex. There is a stair between both floors, along which messages can be given from one floor to the other. This helps us to regulate ourselves and our emotions and behavior. And this is how our brain functions in peace. There's good communication between the upper and lower floor. Now imagine the ground floor registers any sense of danger, and be aware of what's been told earlier, that traumatized people's limbic system is highly sensitive to any cues of danger, up to 10 times more than the limbic system of people who haven't been traumatized. When the ground floor imagines any sense of danger, then alarm bells are ringing. There is panic on the ground floor, and the connection, the stairs, between both floors is damaged, and the upper floor doesn't function anymore, so there are no peacekeepers to control the panic that may be even started without a real danger. The brainstem is taking over, and people just act to survive without thinking. This explanation of brain functioning in mind will help you to understand the next part of our presentation, in which Wendy will tell you about an important concept in trauma, the window of tolerance. After this, we will elaborate more on the earlier mentioned developmental problems. This is the window of tolerance, and at the end of the presentation, there's a link to the site and videos of Ageo Foundation, where you can watch a video about the window of tolerance in English, but there's also a Ukrainian version. We think it's important to understand what this concept means for understanding what happens with children after being traumatized, for example, by the war. In psychology, by the window of tolerance, we mean the zone in which someone can cope with stress. And as long as the stress stays within the window, here marked as the optimal arousal zone, there is no issue and a person can function normally. Stress is part of life for both children and adults. And when this happens occasionally, the brain can handle this stress. When you are within your window, so within the optimal arousal zone, you can handle stress or tension in a good way. With regulation, we mean that you can regulate your emotions. The different parts of the brain work together in an efficient way, and it's possible to integrate cognitive, emotional, sensory, and motor information. And it's also possible in this zone to relate to other people. This is important because when the stress increases, children can often cope with a bigger amount of stress when they are supported by adults, which they can trust. For example, their parents or their teachers. And as adults, it's important to realize that we can help to calm the stress system of a child. In this zone, the level of stress varies and will depend on the situation and condition. For example, when the child is tired or hungry, the stress level will increase. But when a child is going to sleep, the stress level will decrease again. But maybe the next morning, when the child has to perform at school, the stress level will increase again. If stress levels become too high or they last too long, the stress shoots outside this window. And you can also see that in the picture here, the red line either shoots up or down. It goes above the optimal arousal zone or beyond. And at times of stress, the body releases stress hormones that trigger the fight, flight, or freeze reaction. And as we just said, this happens more easily when there's no adult around to help calm them. If you shoot above it, hyperarousal occurs.
then there's too much tension and excitement. And when children are within the zone of hyperarousal, the pulse rises, more oxygen enters the blood, the senses are extra sharply tuned, all to be able to properly assess the danger. And stress hormones are produced that help the body prepare to respond. The child is emotionally and physically overwhelmed then. There's no time to think, direct action is needed, and the body is getting ready to respond. And this response is usually a fight, a flight, or a freeze response, which I will now explain in more detail. First, the fight reaction. A fight reaction is the body's way of preparing for danger. For example, tense their muscles, clench their fists, make restless movements, changing gaze with larger pupils, speak louder, turn red, or become very angry all of a sudden and starts yelling, kicking, hitting, or breaking things. Second one is the flight response. And when children respond with the flight response, they react alertly to their surroundings, which they perceive as threatening, and they do everything to avoid this threat. So in daily life, we can recognize this reaction when kids run out of the situation, sit under the table, don't make eye contact, or fail to complete commands. But also the rebellious behavior in the classroom is an example of this, because children want to increase the chance of being expelled so they can avoid the circumstances that they perceive as threatening, the so-called triggers. The last one is the active freeze. And in active freeze, children remain motionless. This can also be an active form of defense where the body is ready to fight or flee. But all senses are on to continuously scan the environment for danger and for possibilities to escape to this danger. Judging from the outside, you might think that the child lets everything come over him resignedly. But in reality, the child experiences just as much stress and anxiety on the inside as a child who fights or flees. And these actions, fight, flight, or freeze, take place before your mind realizes what's happening. You react with reflex, instinct takes over. And normally, these reactions help to lower the tension and return to your window. But however, these periods sometimes last too long, and then the fighting, the fleeing or freezing is not enough anymore to reduce the danger and bring you back to safety. And then you shoot down, as it were. If you shoot out below, the hypoarousal occurs, and there's too little tension or arousal. And we call this the passive freeze. The child retreats, closes themselves off, avoids situations, and seem unreachable, emotionless, or passive. You can also say that the child turns inward instead of outward, and the body is preparing for serious injury. With the hypoarousal, we often see smaller pupils staring ahead, muscles slacken. It seems as if the child is going to surrender. And it also seems as if the child is not interested in what you are saying, but in this state, the child cannot absorb information. And with the body preparing for serious injury, we know that their pulse rate slows, the blood is drained from the limbs, the breathing becomes more shallow, and the body temperature drops. And in addition, the body produces substances that numb pain. and cause a child to experience a kind of psychological distance to the situation. This creates a kind of rest and increases the body's chance to survive. Maybe you've heard of the term dissociation. Dissociation is a form of hypoarousal. If children have experienced a lot of danger, they have learned that this psychological distance can be helpful. But sometimes they continue to use this way of dealing with stress, this coping strategy, even when the situation is no longer threatening, and then it's not helpful anymore. Chronic and continuous stress can, particularly at a young age, deregulate our entire stress system. That's to say, the system doesn't switch off anymore. A child is then in a continuous state of alertness, ready to fight, flight, or freeze. The stress system becomes so sensitive that it regularly reacts to situations that are not dangerous. In other words, a child is less able to cope with stress. You can also describe it as if these children have a smaller window, and therefore it's easier to shoot outside your window. Traumatized children can be triggered easily and respond with hyper or hypoarousal, or they flip back and forth between these two. And stress hormones are released then at the smallest reminder of a trauma. And these triggers evoke severe reactions. For example, when a child hears a loud noise because someone is dropping a book in the room, this may remind the child of the noise being in the war, and the result may be that the child shoots outside his window.
So with the concept of the window of tolerance in mind, we return to the consequences of trauma for several developmental domains. As we told before, traumatizing, especially in early childhood, has its impact on brain development. And remember the brain structures we talked about earlier. Brain development thereafter has its impact on overall development, especially emotion regulation, learning ability, and social development. And all of these developmental difficulties are reflected in behavior and behavioral problems. As mentioned earlier, the neocortex is an important part of the brain to regulate our emotions and behavior. Growing up in an unstable and unpredictable environment leads to less functioning of the neocortex, which leads to difficulties staying inside the window of tolerance, which in turn is needed to develop a well-functioning neocortex. And this in turn leads to problems in regulating emotions, social functioning, and learning ability. When we talk about emotion regulation, the essence is self-regulation, which is needed for developmental growth. Traumatized children are less capable of regulating their own emotions. They function most of the time outside the window, which even more limits their capacity to regulate their emotions. They need other people around them to help them regulate their emotions. When we look at the consequences for social development, we see that fear and danger activates the alarm system of these children and limits the ability for social learning. When we look at the consequences of trauma for ability to learn, we see there is a direct and an indirect effect. The direct effect is when functioning outside the window, it limits the capacity to benefit from education in the present. And when we look at the indirect effect, we see that a well-developed neocortex is needed for planning and organizing. which is difficult for traumatized children. So we are now going to relate all the previous information to everyday life and offer you some practical tools to deal with traumatized young people. How can we create a trauma-sensitive environment? What are the do's and don'ts? How can we help? First, try to answer some questions for yourself to help you understand behavior. Try to look through the trauma glasses. What happened to this child? What has this child been through? What does the child react to? Are there any trauma triggers? Like Wendy told us before, the book that dropped. What does it trigger? Try to discover what the behavior means. In what way this behavior is helpful to the child. In what way may the child try to regulate itself? For example, if an adolescent hides in his hoodie, is he acting rude? Or is it his way of ensuring that he can stay inside the window? Is he trying to regulate himself? Try to answer the question, is the child functioning inside or outside his window? And is it capable of learning and reasoning at this moment? And keep in mind that alarm bells are ringing too soon, so the child is often outside his window. 3 important goals to create a trauma-sensitive environment. First, connect and co-regulate by being calm, patient, authentic, trustworthy, and empathetic. Ensure the child feels safe with you. You first have to connect before you are allowed to co-regulate the child. Second goal is expand the window of tolerance. If a child is outside the window, then make sure he gets inside first. Only then learning can occur. So what are signs that the kid is functioning outside his window? Wendy told you before. Children can put their hands on their ears, put their hoodie on, go play, demand attention from parents, show dreamy and unconcentrated behavior in class, get angry. The third goal is increase self-regulation, because increasing self-regulation will increase overall development. So 3 important things to remember: connect and co-regulate, expand the window of tolerance, and increase self-regulation. It doesn't have to be really difficult. It can be easy, like children told us. The only thing that matters is really seeing them, really appreciating them. This is the last part of a presentation. It's about resilience and the do's and don'ts. Resilience is something we want to build or increase. And resilience is not a characteristic that the child has or does not have. It's a dynamic process of various factors that can influence each other positively or negatively. And resilience develops in relationship with others. So things we can do to help children is provide a safe place and support, restore connections and create new connections, increase the predictability of life again, increase confidence in oneself and others, and last but not least, have fun together. And we found a quote that fits this nicely. Children may be changed forever, but not necessarily damaged forever. Now I will discuss some practical tips for dealing with traumatized children. And as Dyonne just said, in order to be able to co-regulate, we learned that it's important that you are in your own window, in your own optimal arousal zone, and can remain calm. That helps to observe closely what's happening with a child
and at the same time to be aware of what the situation evokes in yourself. The first one is be reliable, and also then say what you do and do what you say. Children need to know they are safe with you. Do not demand eye contact, because sometimes this is still too threatening for the child. Regular alternation between activities, for example, between cognitive tasks and playful activities, helps children self-regulate. And make sure kids can move around regularly. This helps children to release their built-up tension and to stay in the here and now, so they can come back in their optimal arousal zone or within their window. Other do's, use modeling. And by modeling, we mean imitate what you see someone else doing. And in this context, we mean modeling of moments when you respond to a child with a calm brain, attuned to a child's feelings and thoughts. You not only help a child to become calm at that moment, but you also teach him or her how to self-regulate in the future. Use mirroring, because by mirroring the child's experiences, you help a child to get a better grip on his or her emotions, thought, and behavior. It's important that you recognize the beginning self-regulation skills of a child. For example, when a child is wobbling on a chair or chewing on the strings of a sweater. Naming this helps them become aware of it, and it shows that you understand the child. Use stress relievers, such as creating a safe place, listening to music, to calm down or to become active, tearing old newspapers to get rid of anger, or using a rocking chair. But what's important is practice this when the child is inside the window, because only when the child is inside his or her window, the brain can do its job properly, and the child can learn to apply the activity at a later time. Also really important is developing emotional language together. I mean, look for words that make it easier to talk about what's going on inside them. Because we know that some words will increase stress levels and negative emotions, and others will decrease them. For example, use getting overheated or cooling down instead of getting angry and calming down. Or use the term busy in your head instead of you're not paying attention. And it's also helpful to use the terms inside or outside your window after you explain the meaning of the window of tolerance, instead of being angry or annoying and become calm. Name what you see. For example, I see that your fists are clenched. It looks like you're very angry. And make a connection then between their feelings and their behavior, because they cannot do it themselves. For example, I saw this happen when you were, and maybe it reminded you of. Next, make the environment predictable. This gives a sense of clarity and security. And hold boundaries calmly and firmly. What's important about boundaries is that boundaries also increase safety because they provide clarity. And children often violate boundaries because they do not know or they do not understand them, or because they are outside their window of tolerance. And boundaries, therefore, also offer protection and, like consequences, form an opportunity to learn new behavior and work towards recovery. When setting boundaries or correcting behavior, the most important thing is connect before correct. Connect with a child in a calm manner and pay particular attention to your nonverbal communication. Show empathy and understanding and specify which behavior is not allowed, but also what you do expect. So it's important that you think about what you yourself need to stay calm so that you can apply this. Especially with the traumatized children who are so often corrected in their behavior, it's important to find a good balance between setting boundaries and offering consequences on the one hand, and giving positive attention and affirmation on the other hand. So reinforce the good things and give at least 6 compliments before one correction. Use a time in and a safe space. And with a time in, you do not send the child away, but stay close to the child so that he can express his feelings. And last one, find good cooperation with the parents. We made 4 don'ts. Don't use the time out because it feels unsafe for a child and it reinforces the survival instinct. The next one, be careful not to equate adapting with lowering requirements, because this has the opposite effect. The child again experiences that it falls short. Do not reject the child despite his behavior, and do not fight for control. A sense of control increases a child's sense of security, and the more control you exercise as an adult, the more powerlessness and therefore stress a child will experience, and the more he will try to regain control. The stress reactions are then amplified, and thus the undesirable behavior increases. Okay, this was what we wanted to tell you. Here are some more literature tips in English, Ukrainian, or Dutch. Here, 2 books in Dutch. And the last thing is thank you for your attention and stay strong. Bye.